So epilepsy is a unique diagnosis from a standpoint of the fact that 90% of epilepsy in the world is in low to middle income countries. And that's exactly where there are no neurologists. So I'm Dr. Michael Rubenstein, and I am a associate professor of clinical neurology at the University of Pennsylvania. And I'm a long-term volunteer here at FAME. When I first came, it was the realization that there are a handful, there's probably 5 or 6 full-time neurologists in Tanzania for 55 or 60 million people. And so the number of neurologists here are dramatically low, as is the case in many African countries. And so I realized that, that the issue wasn't only that there were few neurologists here, but the issue was that there were few neurologists here that could teach the doctors here. So for the first several years, that's what I did. I worked with them and I went on outreach clinics to the kind of very remote areas of northern Tanzania here. And I would accompany them on these clinics, and I would also work here at FAME. After a couple years, though, we realized that we could create more of a semi-annual clinic where we would go into the communities and we would just see neurology patients. So since 2015, I've been bringing an average of 6 to 8 residents per year with me. The residents will then pair off with a Tanzanian clinician or with interpreters, and then they will come out and talk to me about the patient, and we'll decide what we're going to do for the patient. And so the goal is to introduce to as many of the clinicians here at FAME how to screen and how to assess neurological patients and treat them appropriately.
My name is Dr. Ann Gatti. I work as an assistant medical officer. I started working at FAME in the year 2012, so this is my 9th year. Yes, I've worked with many residents, so we tend to work together and we learn from each other. Basically, about the neurology clinic, what you've learned, especially on my side, one is doing the neurology exam, and it gives you a clear picture on what to diagnose. And then also we tend to get lots of cases like epilepsy, movement disorders, patients like Parkinson's disease. People come a lot with tension headache, a cluster headache, and also a migraine. So we learn a lot on also how to manage different types of neurology cases.
Neurology clinic is very important for Tanzania because we have a lot of kids who were suffering from epilepsy and seizure. They were not able to go to school totally. They were staying at home because they have difficulty in concentrating on studies. Also, they won't be able to maybe to go to take for lunch or to stay in the class for long hours because of seizure. They were falling in the classes, and even not able to play or staying well with the other kids. So there's a lot of problems.
Dorothea was a patient who, came to see me very early on, and she was a young girl who, at the time, was on medications that weren't fully effective for her, and she was having seizures on a regular basis, and because of the seizures that she was having, was unable to go to school.
Mimi kwanza kabisa ninashukuru sana. Namshukuru sana Michael kwa sababu kama isingekuwa hii huduma niliyopata mahali hapa kwa Michael, huyu mwanangu saa zingine angekuwa ameshakufa kabisa, kwa sababu alikuwa ni wa kuanguka muda wote. Na tangu alipopata huduma hii kutoka kwa Michael, kweli mwanangu aliweza kubadilika, akaimprove. Ilikuwa hata hawezi kusoma. Alikuwa hawezi kwenda shuleni kwa sababu alikuwa ni wa kuanguka. Shule alianza mara tu baada ya kupata matibabu haya. Alikuwa ameshafika miaka 9, nilikuwa simruhusu kwenda shule maana alikuwa anaanguka. Kwa hiyo tangu alipoanza kupata matibabu haya ndipo alipoanza kusoma na hakudondoka tena, kwa sababu nilikuwa nazingatia matumizi mazuri ya dawa.
Maybe teachers can help only when they fall down or whatever, but sometimes other kids may separate from the other kids who are not mentally fit because of the situation they are. So you find sometimes they being separated, or segregated in the schools or even the society.
Katika jamii zetu watoto walemavu wapo wenye ugonjwa kama huu. Wanajamii huwa hawawapeleki katika matibabu, badala yake wanawaficha ndani, wakijua kwamba kwanza watoto walemavu kama hawa ni aibu katika jamii zetu hizi, lakini kumbe sio.
So this project are very important in the society of Tanzania. So everybody should know that the clinic is very important, helping the people. So, and I've already helped a big number of kids under that.
And Neurology Clinic has a huge, very huge positive impact, because for example, like we have very few neurologists in Tanzania, and then for you to book an appointment and to be seen, it's not less than a month or 2 months. But when they come here, they can book an appointment and they can be seen in the next 1 to 2 days. So for me, it's a very positive and huge impact.